definitions of eigenvalue and eigenvector. So as you people know, this eigenvalue eigenvector plays a major role in solving the matrix problems. So likewise, in our day-to-day life, in the name of PCA, principal component analysis, so it plays a major role in various fields. So I think you people have come across some applications based on eigenvalues. I think you have come across that PCA plays a major role in healthcare or in DNA analysis tests and all, isn't it? So whether you have taken case study of eigenvalues? Yes. So you are going to choose a topic of healthcare in eigenvalues and eigenvectors, isn't it? Shall we discuss about the case study of eigenvalue and eigenvectors based on the healthcare? Yes, you can start.
This is myself, P. Teacher from Biomedical Department from SNS Technology. So I am going to explain the empathize part. So before knowing the mathematical side, the hospital should know its own problems. So patients wait for too long, diseases spread too fast, and the medical records are getting overflowed before doctors could handle it. So these are the main problems that are faced by the hospitals. So these can be rectified by eigenvalues and eigenvectors. So these problems not only affect technically but also affect their emotions. So patients feel so anxious, their families feel so helpless, and the staffs also they feel overworked. So from the eigenvalues and eigenvectors, we can study this problem more clearer. So from this we can know where patient flow is very slower and how a disease could spread fast and which rate the disease is spreading. So and also heart disease can also be detected by using eigenvalues and eigenvectors. So by help of this, the hospital could identify the problem earlier and work smoother and rectify the problem with greater empathy. Thank you.
So the second part of design thinking is basically defining. So myself, I am TS from first year Environmental Engineering Department from SNS College of Technology. So today I will be explaining about the define part. So from the empathize part, we have collected a set of data where we analyze the problems faced by the healthcare professionals from their perspective or their point of view. So we realized that eigenvalue actually help in reducing the complex problems, that is complex symptoms, into whole factors that influences the patient's report. So basically they focus on reports or symptoms that is majorly important for the entire disease or through where the entire disease revolves around. So now what is eigenvalue and eigenvector actually helping us? Basically the first one is that it reduces the symptoms, as I said before. Second one, it is majorly it is said that around 2 to 3 symptoms alone can detect the entire disease. So it also reduces the entire system of symptoms into 2 to 3 major concepts or major key components of the symptoms from which the healthcare professionals could identify the disease. So now for example, let's take a clinical example about glucose, that is the glucose type or diabetes patient. So it is said that around 78% of the variation in diabetes could be analyzed by just the major 2 symptoms. So when you use eigenvalue and eigenvector, it reduces into the major 2 symptoms, so from which we can understand the variations. So this way it is said that eigenvalue and eigenvector helps to understand the data or the clinical report precisely rather than guessworks or the ancestral documents.
Hi everyone, I am Shivasa from Biomedical Engineering Department. I am going to talk about the third stage, which is Eigen. It essentially focuses on generating concepts with high clinical impacts. Eigen generally indicates directions of massive influence, so the CAD team can focus on generating interventions that addresses the most important health factors. The use cases are prioritizing interventions that addresses the highest impact dimensions, brainstorming solutions linking to dominant physiological or behavioral modes, also identifying areas of healthcare which require innovation, example health, nutrition and stress management, etc. For example, if eigenvector analysis shows stress affecting glucose levels, the idea generation focus on stress breathing exercise in mobile app, AI-assisted diet suggestions, a wearable patch that alerts patients during elevated stress. Ideation focuses completely on data-driven patient needs.
Hi, I am Eigen from Matrices and Calculus, and I am going to speak about the prototype. The eigenvalue is the major factor that considers the critical factor in healthcare products. Also, in our product, if a PCA stress level shows, the diabetic fluctuation happens in the patient's data, and for that, our data app will be providing stress management prompts and breathing exercise prompts also it is tracking the user's activity and diet plans. If in our hospital workflow, the critical factor is the bottleneck physicians. On prototype, the redesign factors and also the telecommunication support will be provided by the hospital's side. And also in prototype, the eigenvalue is the major factor for the clinical sectors.
Hi, I'm Anjana RS. So I'm going to explain about the testing stage of the project. So in this, the prototype that we made earlier is being tested in the practical environment. So the results that we get from the testing process is that the eigenvalue 1, which indicates the glucose variability and stress, has been dropped to 40%, and the eigenvalue 2, which indicates the diet issues, has dropped by 20%. So this eigenvalues can be used to give a quantitative basis analysis instead of in the subjective basis. Thank you.
Yes, so very good. So you people very nicely linked how this eigenvalue and eigenvector, how it is works on healthcare in our day-to-day life. So traffic flow in hospitals is too high. So you clearly explain how this eigenvalue and eigenvector plays a major role and how we can segregate that into how the disease can be from the